Well, welcome back, everyone. In honor of Heart Month, we're joined today by Dr. Paul Anike from the Lima Memorial Heart and Vascular Institute. He's going to talk about chest pain versus chest discomfort and what you should know to protect your heart. So welcome, doctor.
All right, Chris.
All right. So first, what is the difference between chest pain and chest discomfort? And also, why does that distinction matter?
You know, frankly, these terms that typically interchangeable terms and rather at times confusing. But for chest pain, one might be feeling a sharp discomfort, a sensation of burning in the chest area. And then chest discomfort, some would describe heaviness, pressure, vice-like sensation around the chest, heaviness. Just a sense of uneasiness that they're feeling either at rest or with exertion. And typically these are sudden changes, from no exertional discomfort or pain to feeling something, this uneasy feeling that is persistent.
Yeah, so what symptoms might feel mild or maybe unusual, but could still indicate a heart attack?
That's a very good question. In fact, oftentimes we'll have patients say, well, I don't have chest pain, but they're having a burning sensation. So to them, again, that may be their own description. But rather than the terms, I ask patients to describe us. So they are feeling this sudden change, shortness of breath, just persistent. A new discomfort, like a burning sensation or something just under the breastbone area that is persistent. Oftentimes, it is sudden, it doesn't go away. A burning sensation, it could be atypical type of presentation, especially diabetics and women. They may have jaw ache and nothing in the chest, maybe a little bit of shortness of breath. Those are some of the unusual presentations. To add to that, radiation of pain, one may feel a discomfort in the shoulder, upper back area. That is sudden, again, persistent, typically a new change. That will be some of the other unusual presentations. Those will also should prompt the patient to seek help.
Okay, so there's often advice about chewing an aspirin during a suspected heart attack. So when is that appropriate, and does it actually help?
And really, readily available medication, and that often starts the process of stopping heart attacks. Aspirin is a blood thinner, and the way it acts to block some of these cells we have in our body, the very cells that helps us to stop bleeding, they are inhibited or their action is stopped just by chewing up an aspirin. When you get that sense that this change is not enough, it's persistent, you chew up the aspirin, and it blocks those cells that tends to try to gather and start forming clots. So aspirin, in a sense, helps you from the get-go. So as soon as it's chewed, to start reversing or stopping the process of heart attacks.
All right, so if someone suddenly collapses from cardiac arrest, what should bystanders do immediately?
So the bystander, the first and foremost, is really activating the EMS, meaning dial 911. And then you can help the person who may be having heart attack. So activate EMS first, or if you have somebody that you can talk to, activate them before you get involved with the patient. So the first thing really is using the EMS by dialing 911, because that action really saves lives, because it starts the very process that will make a change between your home and the emergency room of the hospital, the cath lab. That process, once it's activated, they are there within minutes. Then you get to helping the patient with keeping them engaged, checking on them, and also their level of consciousness to know if you need to then proceed to administering resuscitative measures to the patient.
All right. Well, doctor, I really appreciate you coming on today and giving us all the great information. Thank you so much.
Thank you.
All right. Well, don't go away, because we have more and we return.